HealthEd is Australia's leading provider of quality clinical education for doctors and other healthcare professionals. This episode has been made available on Spotify and Apple Podcasts. For free access to the full library of podcasts and to claim CPD for listening, visit healthed.com.au or download the HealthEd app.
My guest today is Dr. Clara Chung, and we're going to be talking about the rare disease Tuberous Sclerosis Complex, but more importantly, why it's so important to diagnose it early and to implement early treatment interventions. Clara is a clinical geneticist at both the Sydney Children's Hospital in Randwick and Liverpool Hospital. She's a conjoint lecturer at the University of New South Wales in the School of Women's and Children's Health. Her clinical and research interest is in Tuberous Sclerosis Complex and also other mosaic genetic conditions. She's a clinician in the Tuberous Sclerosis Management Clinic at Sydney Children's Hospital and is also a medical advisor to the Tuberous Sclerosis Australia Support Group. Hello, Clara, and welcome to today's HealthEd Women's and Children's Health podcast.
Hello, nice to be here.
Clara, I'm really interested in what led you to specialise in genetics, first of all.
Oh, yeah, I don't know, actually. I suppose many of us when we choose our specialties, I did do a term in it when I was a medical student, and it was a fascinating field at that time and still a very fascinating field now. And I do love the work. I love being able to support families through these incredibly tough times, you know, when there's so much uncertainty about what's happening with their child, you know, or just with their family in general. And of course, there's never a dull day in rare disease because, as the name suggests, everything is very rare. So I very seldom see the same thing twice. So professionally, it's probably quite interesting as well.
Clara, let's cover off on some pretty basic questions on TSC.
Yeah.
What is it and how common is it in the Australian population?
Absolutely. So TSC is a genetic condition, which explains why Geneticist is involved with the condition. It is a multi-system disease. So it affects mainly often the brain, the kidneys, can affect the heart. And TSC is caused by either a genetic change in TSC1 or TSC2, so a pathogenic variant. And these two genes are on what we call the mTOR pathway, which is essentially a growth pathway. And the genes as a complex themselves, or the proteins, that the genes code for are inhibitors of this mTOR pathway. And so with the pathogenic variant, the inhibition doesn't work. And so therefore, as you can imagine, there is then overgrowth. So because we've stopped the inhibition. And so it leads to growths in these various organs that I've just named. So the most common ones will be the brain and the kidneys. So, and there's also often growths in the heart, can be growths on the skin and in the eyes, etc. And the other main aspect to it is that it can also lead to abnormal neurology. So mainly in the form of seizures. So the vast majority of people who have TSC will have some form of seizures, and thereby also developmental delay, intellectual disability. And of course, not everyone gets everything, but those are sort of the main features of the condition.
So Clara, can I take you a little bit further on the genetics? I mean,
absolutely.
Is it that there's someone in the family who has it, or does it tend to arise as a spontaneous mutation? What sort of information can you give us there?
Yeah, so it's an autosomal dominant condition, which I hadn't mentioned before. And so therefore, you only need, so of the two copies of every gene we have, you only need one copy to have the mutation in it. And so it could be either a sporadic thing, so a new change in that particular person who has the disease and not inherited, or it could be inherited. And so population studies have shown that it's probably about 2/3 sporadic and about 1/3 is inherited. Yeah, and sometimes, you know, we do know that a parent is involved, but we know that because the condition can be very variable, so some people are, of course, very severely affected, but there are also people who are incredibly mildly affected. And so we do have, in fact, parents who didn't know that they have the condition themselves until they have a more severely affected child who then come to medical attention. Yeah, sometimes it doesn't look like there's a family history, but there is.
Clara, how and when is TSC usually diagnosed?
So traditionally, it's most commonly diagnosed after the affected individual, so usually a child, develops seizures. And most children who, if they were to develop seizures, most of them will develop seizures in the first 3 years of life, but mainly in that first year of life. But more and more, we're detecting and diagnosing patients before they even have their first seizure. And that's important for things that I think we'll get into a bit later. But the other main common ways that people are being diagnosed is firstly antenatally. So the heart growths that I was talking about, which cardiac rhabdomyomas, they can be detected on your antenatal ultrasounds. Often not at the 20-week ultrasound yet. Usually they do need like the later third trimester ultrasounds to do it, but more and more people, as I'm sure you know, Jerry, are getting those third trimester ultrasounds. And so that's often when something like this will come up, where they will see often multiple cardiac rhabdomyomas, or one in some cases, which then leads to the thought process of, could this be tuberous sclerosis? And then, the other group of people would be, sometimes we do have little babies or small children where the parents have noted some hypomelanotic macules, so just white ash leaf macules on their skin that seem a bit strange, and they come to attention that way.
This episode is one of hundreds of informative and free clinical podcasts from Health Ed. Access the entire library through the Health Ed app for healthcare professionals, which you can download today from the App Store.
And Clara, you mentioned early diagnosis. Why is that so important?
Early diagnosis is important because we know that the earlier we treat, especially the seizures, the better the outcome for our patients. So traditionally, when you think about tuberous sclerosis and a lot of what is in the literature at the moment, you'll hear about intractable seizures, very severe disease, severe intellectual disability, and just quite devastating life. But what we find is that if we get on top of the seizures early, if we manage the patients early, then they, might still have some delays, but they do have a better outcome. And we are seeing that more and more now. And we have a study in our clinic where we looked at the people who were diagnosed after seizures compared to those who were diagnosed before seizures. And just as a cohort, the ones that were diagnosed before they have seizures just do better in development in their seizure management. And the other important thing is that now we know that treating earlier is better for these patients. The next chapter, if you like, in treatment and management for tuberous sclerosis is actually pre-symptomatic treatment. So treating them before they have any seizures whatsoever, in hopes that would either even mitigate the seizures altogether or reduce the severity of the seizures. And a recent study, which is called the EpiStop study, used a drug, vigabatrin, which is an anti-epileptic, to do that. And they've shown that has good improvement in the seizures. It doesn't completely take them away completely in everybody, but the outcomes have been very promising from that point of view. And the other benefit of tuberous sclerosis that we haven't gone into is because we know the pathway, of course, genetically and molecularly, of what happens. And thankfully, we also actually have drugs that work specifically on the pathway, which are very aptly named mTOR inhibitors. So the drugs are sirolimus and everolimus, or rapamycin and afinitor as their drug names. And so these drugs, from what I understand, were first discovered for renal transplant patients as immunosuppressants. And then they realized that they actually work on this pathway. And so it's actually a disease-specific drug for tuberous sclerosis. And it works really well. So right now, they're being used to treat the growths that we were talking about. So the most commonly the renal AMLs, which do grow, as well as the subepidermal giant cell astrocytomas, or SIGA for short, in the brain, that also can grow and cause trouble because they grow, and the drugs work very well to shrink those tumors. And because it is a disease-specific drug, the next chapter in research is seeing if using this disease-specific drug would do better with helping prevent or reduce the clinical burden of this disease for patients.
Clara, apart from the medications you've mentioned, are there any other interventions that are recommended for an infant that's being diagnosed with TSC?
For an infant diagnosed with TSC, especially if they were diagnosed before they have seizures, the most important thing for us is to watch them very closely to see if they will ever develop seizures, because we want to catch those seizures as soon as possible. So the bigger delay between their first seizure and when they get treatment, the worse the outcome is, just as a general seizure management thing. And so we recommend any kid who has a potential diagnosis of TSC. So, if there were cardiac rhabdomyomas and they've just been born, or if you saw the hypomelanotic macules.
I thought TSC was a mouthful. That's even harder.
there's a lot of things. We shorten everything, but that one unfortunately did not get shortened. So, if you ever see in your clinic, a parent bringing you a child with, which is probably the more likely thing to see in a GP practice than the cardiac rhabdos, then we usually recommend that they get referred to a geneticist or someone who has an expertise in tuberous sclerosis, to have that chat about monitoring, because we should do regular monitoring of their EEGs even before they start having seizures, so that we catch the first sign that they could be having electrical seizures, to once again treat earlier rather than later.
Clara, it sounds like there's a multidisciplinary team involved here. Who are the people usually involved in managing and treating a patient with TSC?
Yeah, absolutely. So it does, of course, depend on what that patient themselves have. And we do have a tuberous sclerosis management clinic in Sydney, so at Sydney Children's Hospital, which despite it being in a children's hospital, mainly sees kids, but we do also see some adults, and that there's also a clinic, I understand, in Queensland. But in our clinic, we have a neurologist, we have a nephrologist, we have a geneticist, of course, we have a dermatologist as well, to help with the skin manifestations, and we also, a cardiologist is also involved, although for our clinic specifically, they don't come to the clinic exactly. The other person I've forgotten, but very, very important, is our developmental pediatrician, who comes to the clinic, and of course helps manage those developmental concerns that families have.
Clara, if you had to get some key messages out there to primary practice, what would they be?
I think I have two key ones. So the first is the importance of early management and early treatment. So, if there's any chance that this kid or adult may have tuberous sclerosis, for them to be seen earlier rather than later, to get that firm diagnosis, so that we could start any treatment that is required early. And the second one is the importance of actually continued management and surveillance for these people. So I mentioned before that there are things that can grow. So the two things that we worry most about are the SIGA in the head, and the AMLs in the kidneys, and they need regular monitoring, because they can grow asymptomatically until, of course, that patient runs into trouble. And because we have such good medical treatment for them, it will much rather be able to treat something earlier, shrink those growths before they need to go down the surgical path or other catastrophic things happen. And so from that point of view, every person who has tuberous sclerosis should be getting 1 to 3 yearly brain MRIs and renal ultrasounds to monitor for that growth. And the timing, of course, depends on what they see. So a rough thing would be about every 2 years. But of course, if there's anything that is a bit worrying, we do it a bit more frequently, every 1 year. If there's really nothing there at all, then maybe we could stretch that out to every 3 years, which is where that 1 to 3 year thing comes from.
Clara, you've given us so many insights into TSC. But in a podcast like this, we only can ever skim the surface. So I wanted to ask you if you can recommend any good resources or websites where health professionals or maybe families could go for more info.
Absolutely. So there is a great support group for people and families with tuberous sclerosis, and that they're called Tuberous Sclerosis Australia, or TSA for short. And their website has a lot of resources. So this is a patient organisation that was set up by families, and of course for families, and they've been around for about 40 years now. And so their website, which is tsa.org.au, but I'm sure there's an area where there will be a link.
Yes, we'll be sure to put them up, Clara. I'll put them on the Health Ed website so we can all go explore them.
So the website has resources for families and for doctors. So there were a set of resources that were produced especially for people with newly diagnosed or suspected tuberous sclerosis to help them through that initial diagnostic time. And so there's a set which are called the parachute packs for families, and there's an equivalent set that are written for health professionals, and it's just a one-page sort of thing just to give you the nuts and bolts of what tuberous sclerosis is and what the surveillance recommendations are. So there's those resources, and along with that, there's also great resources on that website about what the surveillance and management guidelines actually are for people living with tuberous sclerosis. If you for refreshers and everything, so because we don't remember everything. The other thing that the TSA offers is that there's a nurse. So they have a nurse that is employed that can answer any questions from families and from GPs or other doctors if there are any questions about the condition itself or just for some advice. And she's called Kim, and she's very helpful. And TSA also has educational and sort of webinars and things for education for families and for doctors as well.
Sounds like an absolutely amazing group, Clara, and I will be sure to get a link put up on our site so that people can have a look. Clara, I want to thank you so much for sharing your expertise with us all today. It really has been an absolute pleasure to talk with you, and I hope we can do it again soon, maybe on another interesting condition.
Thank you for listening. Visit healthed.com.au to create a free account and claim CPD for podcasts like this and access a record of your learning. Subscribe to the show on Spotify or Apple Podcasts for weekly episodes on a range of clinical areas relevant to your ongoing practice.